Hello friends, welcome to our YouTube channel Target Nursing. So friends, as you all know that in previous lecture we have started a topic named labor. Okay, so now in this lecture we are going to study about some basic terminologies of obstetrics so that you can clear your concept before starting the topic stages of labor. We have to clear our concepts regarding this terminology. Okay, so before starting the lecture, just do like, subscribe and share the video. Let's start it. Okay, so we are going to see the terminology today. So here's the first terminology is obstetrics. As we have seen earlier in first class or the first video, we have seen some terminology like obstetrics, gynecology. So in that time and in that lecture we have seen obstetrics. So what is obstetrics? Obstetrics is deals with the care of women's reproductive tract and their children's during pregnancy, childbirth and postnatal period. Okay, so obstetrics basically deals with the care of women's reproductive tract, means the female reproductive tracts. Okay, female reproductive tracts and their children's during pregnancy. Okay, children mean the fetus. So in obstetrics, what obstetrics deals with the care of women's reproductive tract and their children during pregnancy and the childbirth and the postnatal period. What is postnatal period? Postnatal period is the period after giving birth to the baby or after the delivery is known as postnatal period. After delivery, the period after delivery is known as postnatal period. Doctor performing such practices is known as obstetrician. So obstetrics mainly deals with the care of women's reproductive tract and their children during pregnancy and childbirth and postnatal period. Okay, and the doctor performing such kind of practices, which those doctors known as obstetricians. Okay, so it is the definition of obstetrics and obstetrician. Now move to the next one. Okay, so there is a terminology which is we are going to study further, which is LMP. So you have to know what is LMP because you are going to hear the word so many times in further OBC. Okay, so LMP is last menstrual period. So as we can see by name only, it is last menstrual period. Okay, so we have already studied about menstrual cycle. So it is about last menstrual period. Okay, the date of last menstrual period. It is the time elapsed since 14 days prior to fertilization. Means it mainly refers to the time elapsed since 14 days of prior to fertilization, means the days before fertilization, before 14 days, and the time between the last menstrual period, like there is 5 days of 5 days of menstrual period. So what will be the last date of the last day? That will be LMP. That will be last menstrual period. Okay, which is last menstrual period. Last menstrual period is referred to the time elapsed since 14 days prior to fertilization. fertilization के पहले का जो टाइम होगा, लास्ट टाइम पे जो menstrual आई होगी, उसे हम क्या कहेंगे? लास्ट menstrual period. Okay, now EDC and EDT. What is EDC and EDT? The due date EDC stands for old fashioned. Okay, so EDC mainly stand for old fashioned estimated date of confinement. ठीक है, what is the full form of EDC? Is estimated date of confinement. It is a old fashioned. Now this is not used. Nowadays we use EDT, which is estimated date of delivery. So you can see only by name that it is an estimation of date of delivery, that we are estimating that the date of when will be the date of delivery. So the estimation of delivery we can only find when we know the last menstrual period. Okay, when a woman know that when was her last menstrual period, then only we can find her EDT, estimated date of delivery. The average pregnancy gestation is 40 weeks. Okay, जो pregnancy average जो pregnancy होती है, gestation जो होता है वो 40 weeks का होता है एवरेज, ठीक है. 280 days होते हैं फ्रॉम द फर्स्ट डे ऑफ लास्ट menstrual period for 28 cycles. So it is EDT, which is estimated date of delivery, and that estimated date of delivery we can only find by knowing LMP of that woman. Okay, now EDT is calculated by taking LMP, ठीक है, as I have told you that EDT is only calculated by taking LMP and adding 9 month and 7 days to it if the cycle is longer than 28 days at difference between the cycle and length of 28 cycle. Means what happens that when we calculate the EDT, we will calculate 9 month, okay, and 7 days to it. Okay, I'll give you the example further. Firstly, see the Nagel's rule. What is Nagel's rule? Nagel's rule is a rule for फाइंडिंग द ईडीटी. ओके, ईडीटी फाइंड करने के लिए एक नेगल्स रूल है. इसमें क्या है, इसमें क्या करते हैं, एड 1 year, subtract 3 months at 7 days from the first day of LMP. Okay, now I'm going to give you an example. Like if a mother is having LMP of 8 May 8th May of 2020. Okay, LMP is 8th May of 2020. So what we can do here, add 1 year. Okay, so we will add 1 year. Okay, like this. Okay, and subtract 3 months. Okay, now we will subtract the 3 months. So May will become Feb. Okay, ये हो जाएगा 2021 and this is Feb, and we will add 7 days in it, which will be 15. Okay, which will be 15. So this 15 Feb 2021 will be the woman's EDT. Okay, when is her last menstrual period will be 8th May 2020. So we will add 1 year. Okay, we will add 1 year and subtract 3 months from the LMP and add 7 days from the LMP date. So we will get our EDT, estimated date of delivery. So it will be 15 Feb 2021. Okay, so from this rule you can get EDT of an woman. Okay, or simply you can add 9 months or 7 days and you can get the EDT of an woman. Okay, so this is about EDT and LMP. And now, what is amniotic fluid? So you all know about amniotic fluid. What is amniotic fluid? Amniotic fluid is in a sac surrounding the fetus. Amniotic fluid is a fluid that surrounds the fetus. Okay, so this amniotic fluid, what do it maintain an even temperature inside the womb. Okay, and it prevents from the injury to the fetus, and it helps to flush the vaginal canal during birth. Okay, this amniotic fluid. Okay, and then comes to Apgar scoring. In pediatrics, we have seen Apgar scoring. We have studied about Apgar scoring. So what is Apgar scoring? It is rating system measuring the newborn baby's general condition on a scale from 1 to 10. After birth, we do Apgar scoring so that we can measure the general condition of the newborn. Okay, it is a rating system. Then comes to the cephalic delivery. Cephalic delivery is a normal childbirth. Okay, so it is in previous video we have seen that which is a normal labor when there is a vertex presentation. So there will be a cephalic delivery, which is a normal childbirth when the head comes first. Okay, It is vertex presentation. When will be the vertex presentation? The cephalic delivery. When the head comes first, it is normal childbirth. When the head doesn't appear first, it's called breech position. Okay. It is called breech position when head doesn't appear first. Okay. When the head of the baby will be on upper side and in downside, the buttocks will be there. Okay. And after that, contraction. Okay. So muscles of the uterus contracting before birth, describing their intensity, duration and frequency. So this contraction is going to increase, decrease by the process of labor. So we are going to study in further video, we are going to study about this contraction, that the intensity, how the intensity is going to increase, how the duration is going to increase, the frequency, how is the frequency going to increase, what will be decreased, what will be increased with the stages of labors. Okay. So in stages of labor, we are going to study about intensity, duration and frequency of contraction. Okay. Now the Braxton Hicks contraction. Okay. So Braxton Hicks contraction. What is Braxton Hicks contraction? Braxton Hicks contractions are sporadic contractions. These are sporadic contractions and relaxation of uterine muscles. Sometimes they are referred to prodromal or false labor. ठीक है, जो ये ब्रैक्सटन हिक्स कॉन्ट्रैक्शन होता है, sometimes it is referred as false labor pain. It believed they start around 6 weeks of gestation. ठीक है. So ऐसा माना जाता है कि this Braxton Hicks contraction is start at 6 weeks of gestation but usually are not felt until the second or third trimester of pregnancy. ठीक है. So this Braxton Hicks contraction is sporadic contraction. Sporadic means क्या होता है? Means which is a pain like which is occurring in irregular interval or the with a contraction. Here it is contraction, so the contraction is occurring in irregular interval. Irregular interval is known as sporadic. ठीक है, means and this will be confined to a place. Confined means it is only in, it will confine to only few places. It was isolated. Only one place the contraction will be happen. Okay? It is not radiating. Okay. And comes to the episiotomy. What is episiotomy? It is an incision to enlarge the vaginal opening for the childbirth, and it is made in on perineum. Okay. Prolapsed cord. Umbilical cord appears before the infant's head. This is a condition we are going to study further. Trimester, 3 calendar months. There are 3 trimester during gestation. Okay. There are 3 trimester during gestation. And then comes to the effacement. What is effacement? Effacement is a process by which the cervix shorten in length and it becomes including in the lower segment. Like the thickness of the cervix will be reduced. Okay, the thickness of the cervix will be reduced and the cervical os and the opening of the cervix become, and the cervical os cannot usually begin to dilate until effacement is completed. Okay, so it is a process by which the cervix shorten in length. Okay, so the length and the thickness of the cervix will be decreased in effacement. What is the mean by effacement? Effacement is a process in which the cervix shorten in length and it become included in lower segment of the uterus, and the cervical os cannot usually begin to dilate until effacement is complete. Firstly effacement will be done and then after only the cervical dilation will be done. Means the cervical effacement is like directly proportional to cervical dilatation. Means when there will be cervical effacement, like the length will be short and the thickening of the cervix will be shortened, then only the cervical dilatation begins. Okay, so जितना हमारा cervical effacement होगा उतना ज़्यादा हमारा cervical dilatation होगा. So they are both directly proportional to each other. ठीक है. So next is show. Show is cervical mucus with blood stain. It is a cervical mucus blood stain, and it happens during labor time. And then lightning refers to the sensation that a pregnant woman feels when the baby drops, means when the baby descend to downward. Okay, and the baby, like the mother will feel that the baby is going to downward. This is the time when the presenting lowermost part of the fetus descend into the maternal pelvis. Okay, when the lowermost part of the fetus is descend into maternal pelvis, that is called lightning. Okay, then comes to the bag of water. The double-walled fluid-filled sac encloses and protects fetus in the warm. Bag of water is also known as amniotic sac. As we have seen amniotic fluid, so the amniotic fluid will be present in amniotic sac. This will cover the whole fetus, and it will protect the fetus from any external barrier, external injury, and it will maintain temperature. Okay, and bag of water is a double-walled fluid-filled sac that encloses and protects the fetus in the warm, and that breaks releasing its fluid during the birth. Okay, the bag of water will be breaks during the birth process, so that it can help, and also it can also help in flushing the vaginal canal during the birth. Okay, and it is also known as amniotic sac. Okay, also called membrane or bag water. Okay, is a sac that surrounds the baby in your uterus, and during pregnancy the sac holds the amniotic fluid, as I've told you, that protects your baby, gives your baby room to move around, and the amniotic sac also protect your baby from infection. Okay, this helps to means this allow baby to move. Okay, move around, and this also prevent the baby from infection and any external injuries. Okay, so this is about amniotic sac and bag of water. Next is gravida. Okay, so you are going to see hear the name mostly gravida. Okay, so what is gravida? It is a number of times that mother has been pregnant. That how many times a mother is get pregnant, it is known as gravida. Regardless of whether these pregnancy were carried to term, a current pregnancy, if any, it is included in this count. Gravida means a mother, how many time a mother have conceived. मतलब एक mother ने कितनी बार conceived करा है, whether the प्रेगनेंसी कंप्लीट हुई या नहीं, वेदर अबॉर्शन हो गया, कुछ भी हुआ, बट कितनी बार कंसीव करा, दैट्स कम अंडर इनटू ग्रेविडा. ओके, like a mother is having 3 childs, okay, and is having uh, abortion before his third child. So how many times she get pregnant? She is having 3 live births. ठीक है, she is having 3 children. This is all. And what, before the third child she has suffered with an abortion. So how many times she how many times she have conceived? That is 4. So the gravida will be 4 of that mother. Okay, then comes to the a newly gravida, nully gravida or newly gravida, we can say gravida is 0, is a woman who has never been pregnant. ठीक है, a woman who has never been pregnant is known as nully gravida. Okay, and then a primigravida. Primi means first. ठीक है, so the mother who get pregnant first time, or who has conceived for the first time, or a gravida one is a woman who is pregnant for the first time, has been pregnant for one time, is known as primigravida. And then multigravida. Multi means many. So if a woman has pregnant or conceived so many times, so more than 2 or more than 3, it is comes under multigravida. Or a more specific, gravida 2 is secondary gravida, gravida 3 and so on is a woman who has been pregnant more than one time. And elderly primigravida is a woman who has first pregnancy who is at least 35 years old. ठीक है, एक तो मल्टी ग्रेविडा होता है, एंड देन आता है हमारा elderly primigravida. So you can see by only name that elderly means having a big age. Okay, so elderly means a woman who is 35 years old or the more than 35 years old and conceived for the first time, that is known as elderly Gravida. ठीक है, so Gravida, how many time a woman has conceived. Gravida, who has never been pregnant. Gravida, who is pregnant for the first time. Gravida, who has more than 2 pregnancy. And elderly Gravida, a mother is having more than 5, mother is of more than 35 years old and conceiving for the first time. This elderly Gravida. Okay. Then parity. What is parity? Parity, it is the number of times the woman has delivered after the age of viability. Okay, parity means age of viability. Firstly, you have to understand that what is age of viability. Okay, so the age of viability means uh, the age of viability we usually include 24 to 28 weeks. ठीक है, means after this time a fetus can survive in external environment. ठीक है, so age of viability means ability to survive. Okay, viability means ability to survive. So we consider 24 to 28 weeks, that after that the fetus can be survive in external environment. ठीक है, the parity is the number of times the woman has delivered after. ठीक है, after the age of viability. It includes the birth after 24 weeks, those having weight of 500 grams. Okay, then comes to TPAL method. Para is often recorded in 4 numbers. ठीक है, so T is the number of term deliveries, that is after 37 weeks. ठीक है, and P the number of premature deliveries, which is premature deliveries before 20 or what before 20 weeks. ठीक है, which is known as premature deliveries. And A refers to the number of abortion, either spontaneous or therapeutic, and L refers to the number of living child, means how many child is living right now. That is TPLA method. Okay, then gestation. Okay, what is gestation? Gestation is carrying of an embryo or fetus inside a female viviparous animal. Mammals during pregnancy can have one or more gestation at the same time. Multiple gestation भी हो सकता है. ठीक है, the mother can conceive one or more gestation at the same time, like multiple gestation, like twins pregnancy, triplet, quadruplet. Okay, then gestation period, fetal development of period from the time of conception until birth. ठीक है, the gestation period is fetal development period from the time of conception until birth. For human, the full gestation period is normally 9 months. As we all know, the word gestation come from a Latin word gestare, meaning to carry or to bear. Okay, so the gestation means mainly to carry or to bear. Okay. Then trimester, the pregnancy is divided into 3 trimester. The first trimester started from last LMP, ठीक है, last menstrual period, up until 12 to 13 weeks, and the second trimester will start from 12 to 13 weeks until 28 weeks, and the second trimester will be started from 12 to 13 weeks until 28 weeks, and the third trimester is from 28 weeks until delivery. These are the 3 trimesters. ठीक है, tri means 3. The first one started from LMP up or until 12 to 13 weeks, and the second trimester is started from 12 to 13 weeks to until 28 weeks, and third is from 28 weeks to until delivery. Then comes to preterm birth. Preterm birth is a birth of baby, as I have told you earlier, baby between 24 to 37 weeks of gestation age. Premature infants at greater risk of short and long-term complication, including disabilities and impediments in growth and mental development. Preterm birth means the baby birth after the time of before the time of delivery. ठीक है, the main time of delivery, the preterm birth will be happen. ठीक है, between 24 to 37 weeks of gestation is okay. Then postterm, pre means before. Okay, post means after. Postterm birth, post maturity is when a baby has not yet been even after 42 weeks. ठीक है, of gestation. Means there is a gestation of 42 weeks, and even after 42 weeks there is no delivery. ठीक है. Different babies will show different symptoms of post maturity. The most common symptoms are dry skin, overgrown nails, creases on the baby's palms and soles on their feet. ठीक है. Creases होंगी, minimal fat, a lot of hair on their head, either a brown, green or yellow discoloration of their skin. Some post mature babies will show no or little sign of post maturity. ठीक है. So these are the sign of post maturity in a baby. एंड इन प्रीटर्म में क्या होता है कि उसमें मेंटल और फिजिकल ग्रोथ रिटार्डेशन हो सकता है. ओके. So this is all for today. We have seen so many of terminology related to obstetrics. First we have seen about obstetrics, then LMP, last menstrual period. Then I have told you that how you will get EDT, estimate date of delivery, by Nagel's rule. Just you have to add 1 year and subtract 3 months and add 7 days from the last menstrual period, and you will get your EDT. Okay. Then we have seen amniotic fluid, Apgar scoring, cephalic delivery, which is normal delivery, contractions. ठीक है. Then Braxton Hicks contractions we have seen, episiotomy we have seen, prolapsed cord, trimester we have seen, effacement. Effacement is the reducing the thickness and the length of cervix. ठीक है. And the show is the cervical mucus with blood stain. Lightning refers to the descent of the mother is having sensation that the baby is descending downward. Okay. And the bag of water, amniotic sac, gravida. In gravida we have seen nulli gravida, primigravida, multigravida, elderly primigravida. Parity we have seen, TPALA we have seen. Then हमने trimester देखा, the first one, second trimester and third trimester. Now we have seen preterm birth and postterm birth and their signs and symptoms. Okay. And then this is all for today. So I hope you all understand. And now we can start our topic, which is the stages of labor. So I just thought that you will get this terminology before starting the stages of labor, because at that time, so that you cannot confuse that what are these terms. ठीक है. तो जब हमारे नॉर्मल लेबर में वो टर्म्स आएंगे तो आपको इजीली समझ में आ जाएगा कि उसका मतलब क्या है. ठीक है. So with this we have completed the topic of few terminologies of obstetrics, and in next video we are going to study about labor pain and stages of labor. Okay. So don't forget to give the feedback of this video in comment section, and don't forget to like, subscribe and share the video as much as you can. Thank you so much.